So why do we need to do differential diagnosis? Differential diagnosis refers to our ability to understand the underlying nature and cause of a disorder. And treatment, when we decide what treatment to use, reflects these theories we have and believe about the cause and nature of the function and dysfunction. And it's important to understand that how you view the disorder, what you believe is the cause of the disorder, will directly lead to the treatment principles that you're going to incorporate in treating this child. So if you can better diagnose, better understand the cause and nature, your treatment will also be better. So instead of having one favorite treatment approach that you adapt and apply to all the children you treat, we can't do that. We have to look at the individual child, assess carefully, differential diagnose what is the problem in this child, and then from your toolbox select the appropriate treatment approach. So literature talks about differential diagnosis, and even literature as recent as 2019 and 2020 discuss the problems around differential diagnosis of speech sound disorders. So in Tarban 2019, which is hot off the press, he mentioned that there's different classification systems that exist. But in most, a description of behavioral speech symptoms are used rather than underlying deficits. So as speech language pathologists, we will look and listen to a child, and we will make a list of the symptoms that we observe in the speech, and according to the symptoms, we will make a diagnosis. We are not looking at the underlying deficit. But there's problems looking at the underlying deficit because we don't have the technology to do objective assessments on speech. We only have our subjective assessments. And when we are using our own sensory, visual and auditory systems to describe these speech symptoms, we are bound to make mistakes. There's bound to be a bias. There's bound to be a misinterpretation of what is happening. So one of the problems with looking at symptoms alone is that different deficits, so there's a different deficit in a different level of the speech motor control system, can have similar symptoms. So symptoms sound similar, but the underlying cause is different.